Good morning. I'm excited to introduce a statewide effort to eliminate cervical cancer in Alabama. Yes, eliminate it. Last fall, physicians and community leaders across the state met to discuss how to eliminate cervical cancer in our state. We discussed the barriers that stand in the way, as well as the solutions that can get it done. Named Operation Wipe Out Cervical Cancer in Alabama is the name of our effort, and today we launch an action plan to do just that. Right now, Alabama ranks third in the nation for incidence and mortality related to cervical cancer. This is not acceptable. Cervical cancer is preventable and it's stoppable, and we can do that. How? 3 steps. First, increase HPV vaccination. Second, increase cervical cancer screening, which is PAP HPV test regularly. Third, appropriate follow-up tests for the screening results that show up with abnormal cells. We can do these 3 things with the help of parents, physicians, business leaders, community leaders, health departments, and academic centers. I would like for you to hear from our partners that help to support this effort and those that work every day toward reaching that goal of eliminating cervical cancer. First, Dr. Isabel Scarinci. She is Vice Chair of Global and Rural Health at the UAB Department of Obstetrics and Gynecology. Second, Anna Lisa Weigel, Associate Director, Cancer Center Partnerships at the American Cancer Society. Dan Stevens, Executive Director of the Rotary Club of Birmingham. Dr. Deborah Smith, Chief Medical Officer, Quality of Life Health Services. And Dr. Heather White, Executive Director of Together for Health. But first, I'd like to introduce Dr. Harris, our State Health Officer.
Thank you, Nancy. Good morning, everybody. Thank you so much for being here. We are really proud to be hosting this event today. We really appreciate all of our partners here. We thank you so much for the great work that you're doing. We're so happy to be working together with you to eliminate cervical cancer in Alabama. This plan is a historic plan. This is a milestone for us. We really believe that we have the tools and the knowledge to eliminate cervical cancer in our state. We know how to do it. We know what needs to be done. And with your help, we know that we can do it. The bulk of the work done against cervical cancer in our department is through the Alabama Breast and Cervical Cancer Early Detection Program. It's a very important program to us. It gets women screened. It gets a diagnostic testing done. It gets them referred to care if they need care. We contract with over 400 physicians and specialists around the state who can see women at no cost to them. This is a program for low-income women, age 40 to 64, and in some cases as young as age 21. It really fills a niche in Alabama that's for women who don't otherwise have access to care, and it's something that's very important to us. A lot of this program is supported with federal money, but I also want to thank the state of Alabama that gives us funding for this as well. We've long had support from our governor, from Governor Ivey, and also from the legislature for this program, and we're very, very grateful for that. Another big part of what we do is maintain the cancer registry in Alabama. It tracks and collects data on cancer cases in our state. This is information that we can use to learn where resources are needed the most, where the greatest need is located. And of course, this is information that we share with all of our partners who can do the great work that they do as well. Finally, I just want to remind people that we continue to do HPV vaccinations in our county health departments. It's amazing how many people I meet who don't realize that we have a vaccine to prevent cancer. We in this room take that for granted, but many people aren't aware of that. We are living in this really strange time right now where vaccine misinformation is running wild. Vaccines of all kinds are mistrusted by a lot of people. So it's very important to continue to communicate the importance of HPV vaccination, particularly vaccination at the right age for young people so that we can prevent this disease from ever even occurring. We're very happy to be part of that. So again, thank you again for being here. We very much appreciate you being here to celebrate a very exciting day for us. Thank you.
Good morning. I am so excited to be here with this plan. I'm Isabel Scarinci. I'm Vice Chair for Global and Rural Health in the Department of Obstetrics and Gynecology at AUAB. And I have dedicated my career to cervical cancer prevention and control, finding ways of preventing this cancer, developing evidence-based strategies. And after 30 years working on this, is very touching that my home state still ranks third in mortality and incidence. Mortality of cervical cancer today in Alabama is no different than 1999. And that I could not end a professional career with those statistics. So we got together with Rotary Club of Birmingham and Together for Health and said, what can we do? And we started saying, well, let's start small, baby steps. Let's pick the county with the highest burden of disease. You know, as a researcher, I think about a pilot. Let's see what works. And we picked Chambers County that has the highest incidence of cervical cancer in the state. It's very hard when you travel to a rural county and say, we are here because you are not doing great. But we didn't give that message. We went to the civic leaders in that county, that is the Rotary Club of Lafayette, and we got a champion there, Dr. Butch Busby, who really took the bull by the horn, and we started work in that county. But before we started, to everybody was important that we could take care of the women that got screened and have cancer. What good does it do to do screened and not have a solution for cancer care? What good does it do to tell parents to vaccinate their kids if they don't know where to go? And Alabama Department of Public Health came full force to this effort, and we're so thankful to Dr. Harris, Dr. Pugh, and Nancy Wright that say, what can we do? Do we need to increase staff? Do we need to increase services? And then quality of life healthcare services came through and say, we can help. And partners kept coming. And we're like Auburn University, Russell Medical Cancer Center, and other partners, and the school system. And we were like amazed with the enthusiasm, and that's how Operation Wipeout was launched. And Nancy Wright, who gave the opening today, she's a true public health leader, and came to us and said, you're doing it too small. We need to go statewide faster. And she came up with the summit that she already described to you, and it was an amazing experience of having these providers to really come together with this plan that we are so proud of. This plan is not about one organization. It's not about one person. If you look at the plan, there are no authors. There's no leading organization. This is those providers that you're going to hear from one of them today, one of the champions that put this together. And we are so proud of our public health leaders and primary care providers across the state. So I started by saying I dedicated my career to cervical cancer, and now I want to dedicate the rest of my life to cervical cancer prevention control, because this cancer can be prevented, and I will not stop until we get there. If you ask me why I'm so passionate about, I do not have cervical cancer, never had cervical cancer, but I have a disease that was eliminated. I had polio as a child, and I can see what a community can do to eliminate a disease. It's no longer in the hands of academic centers, physicians, research. It's in the hands of each one of you who's watching. If you're a mother or a father, you can vaccinate your children. If you are a teacher, you can educate the parents. If you're a businessman or a woman, you can let your employees time off to get screened or vaccinate their children. Everyone has a role in this mission, like we did with polio. And I truly believe, Dr. Harris, that we're going to do it. And Alabama is going to be the model for the country and the world, because we have the tools and we have the people. That's more important. So I count on everyone to do so. And next, I want to introduce Annalisa Wigo from American Cancer Society. Everybody knows American Cancer Society and their commitment to cancer prevention control. And every time we pick up the phone and call ACS, no matter where, and they are there for us and always support every effort. Thank you.
Good morning, and thank you, Dr. Scarinci and her fabulous team. We are so thrilled to be here with you guys and honored that you have called us to join alongside you in this mission to eradicate cervical cancer for the state of Alabama. The vision of the American Cancer Society is to end cancer as we know it for everyone. That is why we are so honored to be a part of this statewide action plan to end cervical cancer for Alabamians as we know it. Nationwide, there will be nearly 14,000 new cases of invasive cervical cancer that will be diagnosed this year, and more than 4,300 women will die from cervical cancer in 2023 alone. In Alabama, we know that there will be an estimated 240 new diagnoses of cervical cancer in 2023, resulting in 110 deaths to cervical cancer this year. HPV can cause 6 types of cancer, including cervical cancer. Cervical cancer is the most common cancer linked to HPV in people with cervix, and nearly all cervical cancers are caused by HPV. Cervical cancer is preventable with vaccines and regular screening. More than half the people in the United States who get cervical cancer have rarely or have never been screened. Cervical cancer testing or screening should begin at age 25, and those aged 25 to 65 should have a primary HPV test every 5 years. The test that tests for cervical cancer is the Pap test and the HPV test. The Pap tests look for changes in cervical cells caused by HPV infection, and the HPV tests look for the infection itself. The most important thing to remember is to get screened regularly, no matter which test you get. If your son or daughter is between the ages of 9 and 12, talk to their doctor about the HPV vaccine. The vaccine is safe and effective and long-lasting. Vaccinating your child at the recommended ages can help keep them healthy well into adulthood and is the best way to prevent HPV cancers from forming later on in life. The American Cancer Society's Mission HPV Cancer-Free campaign is a public health initiative to eliminate HPV-preventable cancers. As a public health problem starting with cervical cancer, our goal is to reach an annual vaccination rate of 80% of 13-year-olds in the United States by 2026. And in order to do this, we need a lot of help. In order to do this, we at the American Cancer Society are facilitating provider training and education, engaging health systems to drive vaccination rate improvements, influencing stakeholders to use relevant data to drive planning and impact, leading and supporting HPV vaccination interventions with health systems, and increasing parental knowledge about the vaccine through news, digital, social media platforms, and by mobilizing the ACS volunteer network, as well as our ACS CAN volunteers to share science-based information about the vaccine. So today, in launching this great initiative, we have the opportunity to continue this work together and join collectively throughout our state to put an end to cervical cancer as we know it. And that is why the American Cancer Society is so honored to stand here with all of you today to help support the launching of this statewide Wipe Out Cervical Cancer campaign in Alabama. Thank you.
Good morning. My name is Dan Stevens, and I'm the Executive Director of the Rotary Club of Birmingham. Founded in 1913, the Rotary Club of Birmingham is the largest in the United States and one of the largest in the world. Health has long been a key focus, not only of our club, but of Rotary International. And our club played a leading role in the worldwide campaign to eliminate polio. The effects of that campaign have been one of the most remarkable achievements in human health in all of our history in the world. It's saved millions of people from a devastating illness through immunizations. We believe that one of the next frontiers for Rotary will be eliminating cervical cancer as a public health threat. We've been involved for several years overseas in Sri Lanka, working with local Rotarians there and government officials and health officials and Rotary International to build capacity for HPV vaccinations in that country and screening and treatment for cervical and other cancers. And we've had very strong results there so far. But today we're very glad to be here with you because we know that many people right here in Alabama are suffering and dying unnecessarily from cervical cancer. But with immunizations, early detection, and treatment, we can eliminate this problem from our state altogether. Rotary can help by connecting leaders across communities in Alabama to raise awareness, to build public support, and to harness the necessary resources to make sure this effort is a success. We're grateful for all the partners who are making Operation Wipeout possible, and we look forward to standing here again with you to declare that we've eliminated cervical cancer from our great state. Thank you.
Good morning. What a great day. What a great day in healthcare. As mentioned, I am Dr. Deborah Smith. I'm the Chief Medical Officer for Quality of Life Health Services. Our corporate offices are in Gadsden. As we came together to work on this plan, my role was provider. Providers came from all over the state. We came from various disciplines, and we came with a zeal to do something different, to make a difference in what data we had been hearing. It was shared with you early on that the data had not significantly changed for a long time. We felt that it was time to take a look at ourselves. The providers talked, we brainstormed, we continued to think, what on earth can we do differently that we have not done before? And that came ultimately with the plan that has been announced today. We felt that it was important that we look at roadblocks, that we listen and make sure that our solutions, as we discuss them, look toward overcoming and opening the way for those women who have cervical cancer. We wanted to make a difference in that screening rate. As mentioned, I am from Quality of Life Health Services. We are a federally qualified health center, FQHC. That simply means we care. We wish to make sure that everyone has access to care. That means whether they are insured, uninsured, underinsured, low income, high income, great insurance. We are there to make sure there is access for care. So our partnership this day is to declare that we have war on cervical cancer. Thank you.
Hi, everyone. I just want to take a moment to acknowledge and thank everyone in the room who's spoken about this exciting mission so far. I feel very energized listening to the potential of what we can do together as partners. My name is Dr. Heather White. I'm the Executive Director at Together for Health. And we are an organization that launched in 2017 with a global mission to prevent cervical cancer through several strategic initiatives. That is influencing policy with decision makers, improving funding, particularly with global funders for this work, and spreading the stories of women, their families, and communities directly affected by this preventable disease. The bulk of the work that we do at Together for Health takes us to low middle income countries. Like Rotary's work in Sri Lanka, we're looking typically outside of the U.S. to bring services, to bring education, and to bring care closer to women in areas where disease burden is very high. But a year and a half ago or so, in late 2021, we committed ourselves as a core partner in Operation Wipeout because, as an Alabamian myself, I was well aware of the high rates of disease in my own backyard in this state, and we felt that we could join hands with other community partners, with academic leaders such as UAB, and with the impressive footprint of the Alabama Department of Public Health to really turn the tide on this preventable disease. So we've been active partners in this mission, and we call upon everyone in the state to work personally, professionally, in whatever capacity you can, to educate, to promote, to go for services, to educate others about the importance of this work, because if everyone pitches in, we know that we can eliminate this cancer. We were at the statewide summit back in October where we put this plan together, and this plan was, as Dr. Deborah mentioned, a direct call to action from healthcare providers who know what it's like working on the front lines in this state. These are very actionable, very explicit activities that we can do together. Improving school-based vaccination programs, mobilizing community mobile resources for women, bringing services closer to women every day in their communities. So again, I call upon each of us to do what we can to bring to life this plan for Operation Wipeout. Just as a final reminder and a call to action, you can visit our website, www.operationwipeout.org, for more details on how you can be involved. Please join us. And with that, I'd like to bring up Nancy one more time.
Thank you for joining us today. I'd like to ask our partners to come up and stand beside me as we finish out the press conference, if you don't mind. Wonderful. Come on up. I just really wanted to leave with a visual that, we've all worked together and can continue working together to eliminate cervical cancer in Alabama. So join us. Work with us. Do the things that we know you can do to eliminate cancer in Alabama. Thank you.